My name is Josh Mugel. I'm the founding program director here at Northeast Georgia Emergency Medicine Residency. I made a video a while back talking about the newness of our program, why I thought it was fascinating to be part of a new residency and what we were building, and why I thought it was a great residency to do your training at, and why I thought Northeast Georgia was a fascinating place and a really strong place to do residency, including the patient volumes and acuity, the strength of our educators. So now I'd like to give an update about where we are now, the type of resident we're looking for, and our culture and our mission and our vision for this residency going forward. So one of the strengths of this residency is that I consider us a mission-driven residency. Our mission is to train excellent emergency physicians. We want to train physicians that are capable and ready to practice in any emergency environment across the world. I don't want our graduates to be limited where they can go, to only be able to work in a suburban environment, to only be able to work in an academic environment. I want our residents to be able to work anywhere. And so to provide training to become excellent emergency physicians, we incorporate that in everything we do, in the rotations we do, in the curriculum, in the way we teach, the way we hire. But most importantly, this has to do with the volumes and acuity of the hospitals that we staff in. As I've mentioned before, Northeast Georgia serves a patient population of about 1.5 million to 2 million people. We have high volumes and high acuity, and our patients are our best teachers. So our goal is to get our residents in front of as many patients as possible, taking care of as much acuity as possible so that they are comfortable graduating and going anywhere in the world to practice and to continue their education. Since we've started, we've had our first graduating classes, and we're starting to see where our graduates are going now. We've had graduates go into fellowship. About 1/3 of our graduates head that direction, which is comparable to the national average. We've had graduates go into ICU fellowships, into anesthesia ICU fellowships, into disaster, pediatric emergency medicine, EMS, and they're going to some of the more elite fellowships across the world: Stanford, Washington University, the University of Utah, Wake Forest. I'm really proud of the fact that we've prepared them adequately to get into these fellowships, and we've given them a strong clinical foundation. But most importantly, we are graduating residents who are prepared to take care of patients in Georgia and in the surrounding areas. Many of our graduates are staying in the community. They're taking care of patients within Georgia. And what I'm most proud of is that we are starting to hire some of them back here to our group, to GEDS, Georgia Emergency Department Physicians, who I work for. And so we're hiring some of our own graduates, which means that we trust their patient care, we trust their clinical abilities, and we want them to come work for us. One of the things I'm most proud of, I get this question a lot during the interview season, is how our residents have developed into owners of their own residency. When I started this program a number of years ago, I had the challenge of building a curriculum, designing a didactic session, making sure that all the faculty were on board, hiring a lot of people. But what I couldn't ensure on my own was that we would have a strong culture and that our residents would carry the mission that we laid down that needed to happen for them to become excellent physicians. So with the first few classes, I really taught them, this is your residency, this is your culture to own, and they've taken that and run with it. Our residents right now are some of the strongest residents in our hospital system, in the region, and I think in the entire country. They know what they have to do to succeed. They know that when they are in the emergency department, they have to work hard, they have to be excellent, they have to study on their own to continue to improve. They know when they're on off-service rotations like the ICU, they have to work harder than anybody else. They have to have a constant positive presence with the nurses. They have to say, what more can I do? How else can I learn? How can I serve these patients better? And they're doing that. They did this without much prompting from me. They've taken this ownership, and they know that everything they do on their day-to-day basis in the clinical environment is reflective on all of the other residents. They are continuing to create the culture. They're continuing to create the reputation that emergency medicine residents have here at Northeast Georgia. And I'm incredibly proud of the work they've done. I'm incredibly proud of the culture that they have created. One of the challenges we have to prepare our residents for is how to be leaders in the field of emergency medicine. And part of this goes to how to be owners of our clinical environment. Emergency medicine, like a lot of different fields, is facing a crisis of corporate interest taking over their groups. I am proud to say that the faculty here at Northeast Georgia and the people who are teaching our residents are part of an independent, physician-owned democratic group. This is important to me, and it's important to expose our residents to this kind of leadership because I believe this is the best kind of leadership in medicine in general. So I want our residents to learn from people who are invested in their own group, who are invested in ownership. But most importantly, I want to give the lesson of ownership to the residents. I want to recruit and I want to bring co-owners of this resident into our residency. I don't want this to be a top-down leadership style. So when I recruit residents, I want to tell them, you're co-owners of this residency. You get to make decisions, you get to have impact, you get to have your voices heard. And this is important to me in my job. I want to have my voice heard. I want to make sure that I have the ability to make changes to my clinical environment, to make changes to how I work, and to make changes to how I practice. And I want to give this same opportunity to the residents. I want to make sure that the residents feel that their voice is being heard. I want to make sure that the residents know that they own the clinical environment that they train in. This is key to wellness. This is key to future leadership. And so I'm very proud to say that residents are co-owners of this program. And what I'm looking for and who I'm hoping to recruit in this residency is people who want to be co-owners. I don't want people to come here and just receive a training, just to be passively fed information to become a doctor. I want people who really want to have their voice heard, who want to make a difference, and who want to change the environment they work in. And these are the people that we're recruiting, and this is who I think will thrive at Northeast Georgia Emergency Medicine Residency. There's a number of challenges that the specialty of emergency medicine is going to face in the years to come. As many of you know, the ACGME, the RRC, which is in control of the National Emergency Medicine Curriculum, has recently said that they think emergency medicine should be a 4-year program, that there are a number of training modalities that we need to implement going forward. We have to do more toxicology, we have to train more on administration, we have to train more pediatrics, we have to train more critical care patients. Our patients are becoming sicker, healthcare is becoming more complex, the electronic medical system is becoming more rigid, and we're having to face more challenges going forward. So many of you know who are looking at this video that emergency medicine is becoming more complex, it's becoming a more difficult specialty, and we most likely will go into a 4-year training program in the near future. So I've asked myself quite a bit, how are we going to face these challenges? How is our residency going to continue to grow and to expand? Fortunately, I think we're already well suited to be able to face these challenges. We already have a very strong ICU curriculum. We already have a very strong toxicology curriculum. We train on pediatric patients on a regular basis. Most importantly, we serve a very diverse patient population. We serve a high acuity trauma population here at Gainesville, but our hospital system also has a number of rural communities, and we have the ability to give our patients exposure to lower resourced, lower volume types of places where they have to practice fairly independently. So going forward, as we continue to face these challenges that face emergency medicine, I think our residency is well suited to continue to grow and to continue to produce excellent physicians for the future.